singular pleasure to be able to make this presentation in order to highlight some of the things that we're going to be discussing during the next 2 days. It's a shame that people of the various ministries who are concerned with diet and what we're discussing, nutrition, are not here, but it's their loss because they still have to formulate the laws and policies in Cameroon that would have benefited from this session. Ladies and gentlemen, let us start what it is all about. Next slide, please. Next slide. When we talk about nutrition, what we're actually saying is that what we eat now is one of the leading causes of death. And I want to elaborate a little bit on that, because what we're trying to discuss today is not only about diet, it is about the impact of what we eat on the health status of the children, that is our grandchildren, our children, our children's children, and ourselves and our parents. And this is important to take this into consideration because we're not only talking about nutrition, we're talking about the impact of nutrition on what we have to do. Next slide, please. And this impact has several matters that we have to look into. It goes beyond individual health. So we're not talking only about individual health. We're talking about the systemic challenges affecting our society at multiple levels. Because you look at diet as affecting the individual, but when you look at the impact of diet and nutrition, it affects health, economy, and development. Health in terms of premature deaths, chronic disease increasingly affecting younger population. Economy increases in the terms of healthcare. Everyone talks about healthcare these days. And of course, development in terms of what we have said as SDGs in the world as developmental factors. This is why addressing non-communicable diseases with a lens of nutrition and diet is extremely important. Let's look at the next 2 slides, please. Next one. This is why we are here. That 74% of global deaths is due to non-communicable diseases. And these are cardiovascular diseases, these are diabetes, cancers, chronic respiratory diseases, mental health, injuries, and you name it. And it is extremely important that in developed countries, they have about 74% death. But what happens in low middle income countries? Over 80% deaths are attributed to NCDs. So when you look at the proportion of people dying because of non-communicable diseases, and you now say, what is the relationship between diet, nutrition, and non-communicable diseases? Next slide, please. Diet is the major driver. Next slide. Diet is the major driver of non-communicable diseases. And let's take some simple examples. High sugar intake. Everyone, when I just came back from a visit, 90% of the people who were sitting with me at the conference, who were Europeans, did not add sugar to their tea. But all the Africans who were sitting with me, except one, I don't want to say the exception, added 3-4 cubes of sugar in their tea. So you understand the impact. And what does it lead to? Obesity, diabetes, dental diseases in our children. And again, if you look at excess salt consumption, when you go to East Africa, when they're eating what they call nyamachoma, which is beef, they actually add salt, and I have my friends who add a ton of salt in their diet. What does that lead to? Hypertension, cardiovascular diseases. And then I will use a typical example, which all of you know. When you go to most of our quarters, you see women frying beignet. They use the same oil, fry it, then the next day they fry it. When they produce, the oil produces what they call trans fats. That is, fats that have been denatured. But when you go to our shops, you look at ultra-processed foods. All these are high in sugar, salt, and unhealthy fats. And this has a negative impact in terms of non-communicable diseases. Next 2 slides, please. Yeah. Now we've talked about the world. What about Cameroon? Because this is important. We are in Cameroon. We've done several studies, which some of you would hear from some of them. Very important. But if you look at Cameroon, 43% of all death is due to non-communicable disease. I say Cameroon. And then it's already in Cameroon that you have maternal childhood, malaria, TB, and the rest infections, which we always said has a high mortality. Of course, if you have malaria and you take your quinine, will you die? No. If you have an infection and you treat it with the proper antibiotics, will you die? No. But if you have diabetes, you don't treat diabetes. If you have high blood pressure, you don't control the high blood pressure. The impact is you have a stroke for high blood pressure. You have kidney and eye failure from diabetes. And these are the things that will drain the health budget. So having diabetes, high blood pressure, non-communicable diseases is an effective strain on the healthcare budget. So it's better to prevent it and it's better to control it early. So these are important concepts that we need to know if we have to actually manage non-communicable disease. Unfortunately, even the lights will not stop me from giving my talk. So I will be reading from my tablets. I came with my tablets very ready. And the reason being that I've organized so many meetings in Cameroon, and one of the failures I always have is electricity. Yet we have waterfalls, we have solar, but we never use them. But if you look at the national burden of diabetes, and we're reading from my tablet, cardiovascular diseases causes 29% death in our country right now. Cardiovascular diseases. And that is not only stroke, high blood pressure and the rest. And then cancers, which we call neoplasms, they account for about 16%. Diabetes and chronic kidney diseases with about 11%. And I want to mention here when I talk about chronic kidney diseases, I have never seen a place in the world where instead of giving drugs to people who have diabetes and high blood pressure, they construct national dialysis services all over the country. Which means that what you do is, instead of closing the tap so that those diseases should not flow, you let them flow and you mop the diseases on the floor when they have kidney failure, when they are about dying. You need to treat the people so that they don't have the complications, rather than wait for them to have the complication. Then the other NCDs 8%, digestive diseases 8%, transport and injuries 7%, and most people did not know that injuries, domestic injuries, transport is a non-communicable disease. And of course, you have self-harm and interpersonal violence, as we've been noticing in Yaoundé recently, and that is about 4%. So the causes of NCDs, can you remove we know that you are handsome, but can you remove yourself from? Thank you. And then we know that these causes of NCDs are in our homes. Injuries. Imagine the road traffic accidents that we have in this country. And these are all NCDs. Next slide, please. I want to talk about something which is very passionate to me. Because sometimes it is too late for you to act. But is it too late for your grandchildren, those of us who have grandchildren, and our children? No. So if you don't want to apply what we are talking about to yourself, think about your children and your grandchildren. And this slide clearly illustrates that things like obesity, if we look at obesity in Cameroon, and this is a meta-analysis, boys and girls, they are 26% overweight in young children between the ages of 9 and 19. And then 15.1%, and then those are adults, 15.1% of adults are obese. Next slide, please. But when you look at children, and these graphs clearly, please, you are blocking people. These graphs clearly illustrate what I want to discuss with you today. And what you'll be hearing during these 2 days. Imagine children from 5 to 19. That almost 10% of boys and girls already carry over obesity at the age of 19 to adulthood. These children are starting their lives, adult life, already obese. And that is why in our country, we have so many young patients with diabetes. In the European countries, you have type 2 diabetes at the age of 50, 60. In African countries and in Cameroon, they start having type 2 diabetes in their 30s and 40s. And imagine living with diabetes without treatment for 20, 30 years. You develop kidney disease, you develop heart disease, you develop other diseases. So please, let's be careful with our children so that they don't carry this factor. The next 2 slides, please. So, what about the food environment? Because our being here is to talk about food environment. There is increased availability of ultra-processed foods in the markets. Look at the type of oil we cook. At first, when I was young, and that was so many years ago, I ate rice only at Christmas. And you know the type of rice? Cock, the one with the cock, unpolished rice. Rice has become a major staple in this country. Processed food, we are starting now in the urban areas. People now shop in the supermarket. They no longer go to buy vegetables. And in the urban and peri-urban regions of Cameroon, we have easy access to sugar-sweetened beverages. Whenever I pass through the streets of Yaoundé, Douala of Cameroon, I'm amazed at the incubators of cancers, of diabetes, or high blood pressure. Why do I say so? Look around you. How many of those plastic bottles with sugar-sweetened beverages are exposed to the sun and made large with plastic? These are sources of cancer. And then again, our children start taking sugar-sweetened beverages very young. That's what we put in their pockets. Those are the sources of obesity, high blood pressure, and diabetes. Ladies and gentlemen, we have to do something about it. Starting on not doing anything is no longer an option, because if we don't do it, the consequences will be great. The next slide, please. Let's talk about marketing. When you open your TV, how many times do you hear about eating the healthy foods? When you go to the supermarkets, where do you see the healthy food component? You see mostly the sugar-sweetened beverages, you see the refined oils. Therefore, our marketing strategies have gone wrong, and most of these target children and young adults. And this is part of our discussion today. How can we limit the sugar-sweetened beverages? How can we make sure that when you go to the supermarket, when you are buying something, they talk about glucose, protein, sugars, everything, so that when you take it, if you need something, you don't need high sugar, you'll be able to get it. And we need to be able to promote branding of good foods. If you look at around the world, and especially in Africa, they have banned all those trans fats and the rest from Europe and North America. And the people have transposed that industry to Africa. Tell me the village in Cameroon where you will not find sugar-sweetened beverages. But these are the same villages in Cameroon where they grow pineapples, oranges, and the rest. But they don't commercialize them. Tell me in Cameroon when there is mango season, how much mangoes are wasted? Why can we not transform the mangoes to mango juice, the oranges to orange juice? Why do we depend only on giving our money to those with sugar-sweetened beverages? Next slide, please. But there are also social determinants. Next slide, please. There are also social determinants. Poverty. The easiest food in every Cameroon society, especially urban, is bread. Isn't it? It's bread. Everyone wants to eat bread. And then people from this area, they eat bread from morning, afternoon, evening. Okay? Because that's what they eat. And these are processed food, and the poor go to eat. And urban lifestyles. How many people in Yaoundé have gardens? But if you look in London, France, people have little gardens, vegetable gardens behind their house, even at the top of their city. We don't. We want to embrace the Western lifestyle cultures without embracing the disadvantages. And then health inequity. We grow, the disadvantage and left to die. The advantage people can use their money to die. So what are the consequences? Next two slides, please. You have health impact, which I have discussed with you. You have economic burden, which I've told you about the healthcare cost, and inequalities. People who don't have easily buy the cheapest food, and the cheapest foods are the unhealthy foods. So, ladies and gentlemen, what has Cameroon been doing? Next slide, two slides, please. We have been justifying our actions, saying that educate the people. But how can you educate people to eat healthy when the food environment is not healthy? If one wants to eat vegetables, they can't find the vegetable, or the vegetables are more expensive than the cheap ones, which are the refined ones. They go for the refined ones. So we must improve our food environment. Saying that people should exercise and educate people is not enough. We cannot expect individuals to make healthy choices in unhealthy environments. And then again, we need, as we'll be discussing today, to look at different types of finances and the different types of things we can do to improve the food environment. You'll be hearing about front of package labeling. You'll be hearing about labeling choices. You'll be hearing about subsidies for health, for healthy diet. We'll be talking about taxations. What can you do in order to improve? You tax on healthy diet and you use that to promote healthy diet. And some of these discussions we'll be discussing today. And I want to end here by saying, it's not that Cameroon is not doing enough, it's that Cameroon has policies. Next two slides, please. We have policies, we have developed policies. Next slide, please. All over, one of the best countries in the world to live in is in Cameroon, if you understand what it is. And the WHO has the best buys that we can depend on in terms of sugar beverages and also processed fats. Let's use examples like what has happened in English-speaking Africa, like in Rwanda and other countries in Africa, who are safeguarding the health of the population by passing laws in favor of this population. Why do I say so? If we don't do what we are promulgating for us to do today, be careful, you need to construct so many cardiac emergency units. We need to construct more dialysis units. You need to build a country from afresh, because the cost of inaction is more than the cost of action. The cheaper version is for us to pass the laws, implement the laws, and then we'll be able to safeguard the population. So, ladies and gentlemen, the good question is not whether we act, but how fast we act. Because every delay increases the burden. So I appeal to all of you as you are discussing with these 2 days, not to think only of yourselves. Think of your children, your grandchildren, your great-grandchildren, for those who have, and think of what will happen to this country when you have so many people dying from non-communicable diseases. It's already 43%, and it will go up to about 80% if nothing is done about it. I want to thank you for listening, and I hope you will have a good day.